into the state of COVID-19 globally, let's bring in Dr. George C. Benjamin. He's the Executive Director of the American Public Health Association. Welcome back as always.
Hi, thank you for having me.
So I want to first get your reaction to the WHO again calling for wealthy countries to hold off on boosters.
Yeah, we've got a lot of work to do to make sure that we vaccinate the rest of the world. Of course, here in the United States, we are focused, at least initially, on boosters for people who are not really fully vaccinated because they have a low immune status. But there's going to be a big debate here about whether we really go ahead and give boosters anytime soon in the United States. And I got to tell you, there's an ethical issue here involved. And we have to be very careful that we don't vaccinate people that don't necessarily need it and deny vaccinations to people that absolutely
To get those shots out to more places. How is that going?
Well, you know, we've only got somewhere around 30% of the world that, if at best, vaccinated, and those are mostly all wealthy countries. So certainly the low and middle income countries are not adequately vaccinated at all. In fact, many of them really haven't started at all. That's a big problem. And, you know, we're seeing these variants that are developing, again, all around the world. And that just serves as a process, a place where those variants could ultimately explode and then really make all of our vaccinations useless.
So then talk about the latest COVID numbers and the potential areas of concern as the U.S. heads into the holiday weekend and, of course, children going back to school as well.
Well, you know, we've had some significant problems in the United States, particularly in places where they did not adequately vaccinate. So those were primarily in the South of our nation, primarily the Southeast. And I think there's a good news, bad news story there. The really bad news, of course, is that the hospitals are inundated with lots of sick patients. There is some early indication in a few of those states that this current wave may be beginning to plateau, but that remains to be seen. We're still very concerned about those states. And by the way, this is a pandemic primarily amongst the unvaccinated.
And as we mentioned, school back in session in several cities. Do we know what the latest guidance is on protecting faculty and students, especially those ineligible for vaccination?
Well, the best way to protect the kids right now, of course, is to have all the adults vaccinated. And in the United States, that's anyone 12 years of age and older, but also to wear a mask. So what we're doing is certainly encouraging all of our children to wear masks. There are some parts of the country that are resistant to that for sure. That's unfortunate. And by the way, we're seeing outbreaks amongst those parts of the United States where they're not doing the basic fundamentals of wearing a mask and having all the adults vaccinated.
And we did even see that popular conservative U.S. podcaster Joe Rogan, who is known for criticizing COVID vaccines and pushing pandemic skepticism, he contracted COVID. Now, he says he's taking a cocktail that includes ivermectin. There's a lot of misinformation and even some panic buying of the animal deworming version of this, which the FDA has warned against. Clear up the confusion on ivermectin and whether it's an effective treatment to either prevent or cure COVID.
Yeah, ivermectin has no role in the treatment of COVID. It is a deworming medication. There is a human variant of it, but it's only for treating worms. It should only be used under the guidance of a licensed physician, and no physician should be prescribing ivermectin for COVID.
Now, something else that he's also using, we also saw that story on monoclonal antibodies. Talk to us about that. We're also seeing research on llama antibodies. What do we know about those treatments and how readily available they are for COVID sufferers, especially in some of these communities that don't have access to a vaccine?
We're really underutilizing monoclonal antibodies in our country, and there's a disconnect because in many people who have early symptoms, they would really benefit from these monoclonal antibodies. What the monoclonal antibodies do is basically give you the protection for a short period of time that the vaccine would have given you. So you basically go to someone who's been vaccinated, you gather up the antibodies that their body made, and then you give it to someone who's not been vaccinated. And so in effect, it protects you very early on, but it's not permanent protection. And at some point, you also, of course, will need to be vaccinated. And the big issue here is, if you don't have access to health care, you don't get into the doctor early, you don't show up for your symptoms early, and you don't suspect you have COVID, or you don't really believe that it's going to help you, then you're denied that very, very life-saving care.
Indeed, important words of wisdom there. Thank you as always. Dr. George C. Benjamin there, Executive Director at the American Public Health Association.